My name is Dr. Christy Webb, and I'm a psychologist in Chapel Hill, North Carolina. One of my treatment specialties is borderline personality disorder. People who have this diagnosis are highly emotionally sensitive, and they may even be suicidal and or self-harming. In this video, I'm going to talk about cutting, what it is, why someone would do that, and how to help a person stop cutting himself or herself. Like most forms of non-suicidal self-injurious behavior, cutting involves the deliberate alteration of bodily tissue. That's its basic definition. The person who cuts himself does so with no regard for issues of health or safety, such as that the wound might get infected, or he might cut too deeply, or she might sever a major artery. Although usually people who cut themselves are really careful. They might disinfect the blade beforehand, and they're pretty good about wound care afterwards. Most non-suicidal self-injurious behavior starts in early adolescence, and research has shown that about 9% of teens do it. So why would someone cut herself? It hurts and it can leave scars. Why would you do that? It's important to remember that cutting is actually perceived by the person as a way to stave off suicide. It's life-sustaining, not life-ending. It's a solution to a problem. The problem is emotional pain. Cutting helps the person to feel better, and it's done for the relief of pain. And we can all understand that because we don't like to wander around in pain all the time either. So cutting is actually a skill, even though it doesn't seem like it to everyone else, and it's not a skill that I want anyone to keep using. The person's trying to overcome emotional pain by using physical pain. Sometimes the person has dissociated. That's to say that the person's mind has left his body so that he's not even aware of feeling bodily pain. Cutting releases uncomfortable emotions and tension the same way that a regulator valve does on a pressure cooker or a radiator. Remember that these people's emotional systems are more sensitive than most, and when their thoughts or feelings become intolerable to them, they look for a release. Cutting is one way to release tension. Of course, there are others. Now, there are other reasons why someone might cut herself. It's a way to bring oneself back to reality, to escape from a sense of being numb and empty, which is one of the core symptoms of borderline personality disorder. Like anything that hurts, cutting releases endorphins, which help the person to feel better in that moment. Cutting can be a way for someone who dissociates frequently to end the dissociation, to bring himself or herself back to reality. Of course, the problem is that then the cutting takes on a life of its own. If the person has trouble expressing himself using words, the scars of self-injury create an external symbol of inner emotional upheaval. For some people, cutting serves as a punishment, or it can be a kind of a cleansing to watch the blood wash away. There's a high incidence of a trauma history in those who cut, although, of course, not everyone who cuts has been traumatized. But for those who have, cutting themselves provides them with a sense of power and control, things that obviously they didn't have when they were being abused. It's also a way of showing how much she hurts, to shock or to wound others, or simply to get them to pay attention to how much pain she's in. There's a strong interpersonal communication component to cutting. It's a powerful way to communicate about one's identity or identity struggles using one's external appearance. In some cultures, scarification, which is what it's called, is a sign of someone who's a survivor or a warrior. It's not uncommon for people who cut themselves also to have tattoos and or piercings, and these are other forms of interpersonal communication about their identity, about strength and the ability to survive pain. Finally, some people, especially teens, might just try cutting out to see if it will help them better handle the stresses of, for example, adolescence. So, how can we get people who cut themselves to stop it? Psychologists understand that all behavior is learned and can be unlearned. Now, probably you don't care why your friend, your child, your roommate, your partner, your relative does it. You just want it to stop, right? So here are some immediate, gotta stop it right now suggestions, ways that you can intervene or that you can use yourself if that's applicable. Draw on yourself, preferably with a red pen. Hold ice for 5 minutes. Don't let go. Bite into a hot pepper, and I mean a really hot pepper, like a jalapeno on steroids. Put Elmer's glue on your body, let it dry, and then slowly peel it off. Bite into a lemon. Stomp on the ground. This one is particularly satisfying if you stomp on the cans that need to go into the recycle bin. I teach my patients to surf the urge, to treat it as if it's a wave. It rolls in, and it's going to roll back out again. Anything you can do to distract the person may be helpful. Since cutting is soothing to the person who does it, substituting a different self-soothing behavior, a healthier one, may be effective. Some therapists suggest that the person who wants to cut himself or herself write his or her feelings down, name them, ask, what have I done to ease the discomfort so far? What can I do that won't hurt myself? And how will I feel about myself tomorrow if I cut myself right now? If you're trying to help someone who's in a crisis, it's essential not to shame the person, either for having already cut or for wanting to cut. That only adds to the problem. Now, over the long term, there are some psychological treatments that have been shown to work according to research. Mentalization-based treatment, or MBT, is a psychoanalytic talk therapy. It's conducted in both individual and group sessions, and the focus is on the person's sense of self. It's been shown in studies to reduce both non-suicidal, self-injurious behavior and suicidal ideation. Dialectical behavior therapy, or DBT, has been shown to be more successful than other forms of therapy or medication, although both of those can be great adjuncts or additions to DBT. You can learn more about DBT in several of my other videos, but right now what I'll say is that DBT teaches dialectics. It teaches that nothing is all or nothing, either good or bad, red light or green light. Everyone has a piece of the truth. It also challenges cognitive distortions or twisted thoughts such as, I'm bad because I cut, or I have no choice, I have to cut myself. DBT also teaches skills, and then more skills, such as those that I've already mentioned, like distracting oneself from the urges or surfing the urges. DBT teaches how to survive a crisis without hurting yourself. Now, if you have more questions about cutting, about borderline personality disorder, about DBT, or about anything else I've said, please take a look at another one of my videos, which is called, rather obviously, If You Have Watched My Videos and You Have Questions. And for now, thanks so much for watching.